Welcome back to Sedok Health, a platform where you get to ask all those biting questions and you are duly answered. Like we said, we are trying to bridge that gap between the doctor's perspective of how diseases go and the patient's. I'm here with my colleague Dr. Dan Sechiunga and I'm Dr. Job Odoji. Our topic for today is cervical cancer. Dr. Dan, what is cervical cancer?
Thank you very much, Dr. Job. Cervical cancer is the cancer of the cervix. The cervix is a part of the woman's reproductive system. We usually call it the mouth of the uterus. Now, when cancer goes into that part of the body, we call it cervical cancer.
So, cervical cancer, what exactly causes cervical cancer?
The cause of cervical cancer is a virus we call human papillomavirus, shortened as HPV. HPV is a sexually transmitted infection. So when someone has HPV, they can get cervical cancer. There are very many strains of HPV, the human papillomavirus. Some strains are weak and they just cause the regular genital warts. However, other strains are quite strong enough that they cause change of the cells of the cervix, which eventually form a cancer within the cervix.
So, talking about and us knowing now what cervical cancer is, what causes it, how will someone present with cervical cancer?
Now, cervical cancer, someone will present majorly, the commonest symptom is bleeding. Abnormal bleeding, maybe you find someone bleeds in between their periods, or continuous bleeding of a female, right? The other could be, we call it postcoital bleeding, bleeding after having sex. That could be the other problem. The other symptom could be a foul-smelling vaginal discharge, that has been treated as an infection for quite long but does not really get well. Then, of course, averagely, a woman with cervical cancer will be about the age of 35 and above, averagely. Other people can present with symptoms as failure to pass stool when the tumor is so big and is compressing against the rectum, difficulty passing urine, painful urination, but that's when the cancer is much more spread probably to the bladder or to the urethra.
So, Doctor, the symptoms you're giving us, it looks like there are those when the cancer is full-blown. What if when the cancer is just starting? Are there any symptoms that someone can pick out and run to the hospital so that it is got early enough?
In early stages, most patients may come with discomfort while having sex or painful sexual intercourse.
So, these symptoms are now in, doctor. How best can one be helped?
Now, as we all know, there's an old saying that says prevention is better than cure. So treating cervical cancer is very expensive, one, to the government, especially to us in developing countries. It's very expensive, and of course the quality of life, once the cancer is spread, it's very difficult to manage. The best mode of combating the cancer would be prevention. And that's why the government has come up with policies like vaccination against human papillomavirus. The government has been vaccinating especially young girls at the age of about 9 years against the human papillomavirus, which we saw is the cause of cervical cancer. Of course, educating our girls to have a later sexual debut can also help to prevent against cervical cancer. Regular screening of females, especially from about maybe age 21 and above, is also very helpful. Having a regular pap smear. A pap smear is a simple test your doctor will do by inserting a speculum into the vagina. During the speculum examination, the doctor will be able to look at the cervix at first to see how the cervix looks. Now, normal cervix looks like the lips, okay, and usually has no lesions or swelling on it. Usually, it's not easy to bleed, okay. But now when the cervix becomes easy to bleed, has any swelling around it, it is suspicious for cancer of the cervix. So a pap smear can be done regularly to screen for cervical cancer. For normal population, we do pap smear every 3 years. In patients with a compromised immunity, say for example HIV patients, we do pap smear after 1 year. So once we do the screening, it helps us to detect cancer in early stages. To best treat cancer, it's always better we detect this cancer very early. And that's why we have been saying screening is very important. So once we detect the cancer very early, measures can be put in place to help in treatment of cancer. Before the cancer comes, we have what we call pre-cancerous lesions or swellings. Pre-cancerous swellings. Pre means before. So these are swellings that happen before the real cancer comes in. So the cells start to change from normal cells to a bit abnormal cells before they become overt cancerous cells. Now, once we pick the cervix at that stage of before complete transformation into the cancer, treatment can be done. And some of the treatment modalities there could be freezing the cervix, okay, what we call cryotherapy, and could be removal of the cervix and sometimes the uterus completely, so that to remove the cancer.
Dr. You have talked about the treatment. We have always known that surgery is done to prevent cancer or its spread. Is it the same situation in cervical cancer?
Now, surgery is an option in cervical cancer, but it depends on the level of the cancer. If cancer is in its early stages, we are able to do surgery. Sometimes we do surgery, remove the entire, we call them lymph nodes, the swellings that have been left by the cancer. Surgery is very important in early stages. However, in later stages, surgery alone cannot be used to treat the cancer. In later stages, surgery can be done in combination with things like radiotherapy. And this can help to reduce the tumor load in the body. So once the surgery is done, you reduce the number of the cancerous cells in the body, so that radiotherapy can also continue from there. But once the cancer is spread to every other part of the body, what we call stage 4 cancer, usually the treatment, we call it palliative care. We just treat the symptoms and hope the patient probably live a better quality life.
Thank you so much, Dr. We have looked at cervical cancer, the cause, the symptoms, treatment, and how to prevent cervical cancer. The month of January is the Cervical Cancer Awareness Month. We hope this video helps you. Spread the word, let everyone know, let us beat this cancer, which is very stubborn and very common in women. Like we always say, share the information, don't be selfish. Like this video, share it with your colleagues. For our newcomers, subscribe to the channel and you will always get the right information concerning your health. Say Doc Health, ask the doctor.